Emerson was diagnosed with an omphalocele, which is an abdominal wall defect. A lot of the nurses said that this was the largest omphalocele they've ever seen.
We knew it was going to be a rough beginning, but based off of every recommendation from everybody, they all said that we should go to Children's Health.
We offer every type of surgical subspecialty a baby could need: general pediatric surgery, ENT, plastic surgery, neurosurgery, and a wide gamut of other surgical specialties. They get a tour of the hospital, they get a tour of our NICU, they get to meet some of the people that they might interact with when the baby comes to the NICU.
Different families define what success or what they want. We try to align what it is that they want with what is probably medically feasible for them.
We want to listen to them, and do what they think is best for them and their families.
Everybody was very honest and forward about everything and every step along the way on how they were going to custom all of the care for Emerson. I know we wouldn't have had the same experience elsewhere.
We have social workers, case managers, psychologists, child life, music therapists, developmental therapists, in addition to the medical team and the bedside team.
That is all part of this multidisciplinary approach where the family truly feels like there's someone with them for each part of what they have to go through, whether it's the emotional support or the medical advice.
She made me feel like I was part of the team of care. They would just say, like, hey, our diaper's wet, do you want to change it? And that sounds so small, but when you don't get all of the good stuff, it's nice to be doing the little stuff.
We have a discharge plan that starts weeks to months before we know a baby is going to go home. We make sure they get all the resources, that they have all the medical equipment, that they have stayed in the NICU overnight, that they have cared for their child. They're able to do basic and advanced care for their child.
They can go to the C7 side of the NICU and really work on goals of going home, feeding by mouth and not by the feeding tube, or they are just on a little bit of oxygen that they're slowly trying to get off of.
Whenever we do come home, it wasn't just a complete culture shock where everything was falling into our lap. That was an amazing and crucial part of the graduation process.
This isn't only about that particular surgery. This is about how do we take care of you, your child, your family from prenatal to the NICU and after you go home. Walking through it with them, holding their hand through the most difficult period of their life, and supporting them through whatever questions and concerns that they have.
This was our home for 75 days. Everybody was going out of their way to make you feel like you were important and you're not just a bed number. And so the Children's Health team definitely went above and beyond, and they should be proud of what they've created so far.